This is Pod Populi.
Podcast for the people.
Hi, this is Pamela Wirth with the Encourage Your Wellness podcast, and today I have Dr. John Bartemus. Fantastic background and so many things that he's doing to help so many others. International #1 bestseller author of the Autoimmune Answer, member of PANDAS Physicians Network, International Human Nutrition and Functional Medicine, and the list goes on, and father of 5, CrossFit enthusiast. So thank you and for being here.
Yeah, thank you for having me. I'm happy to share with your audience.
Touching on autoimmune, they're saying now that 1 in every 5 people is being diagnosed with an autoimmune disorder. So many physicians and practitioners believe that, those are merely just names for inflammatory responses of a certain part of the body. What do you suggest, or what do you like to do in terms of a protocol for people that have been or have a loved one that's diagnosed with an autoimmune disorder?
So I had a consultation with a lady yesterday who called, and she said, I have, it was some acronym like 6 or 7 letters long. And she's like, have you ever heard of it? And I said, no. And she said, it's a rare autoimmune disease that attacks the kidney. And I've been to Mayo Clinic and they have no answers for me. I've been to Wake Forest and they have no answers for me. Can you help me? And I said, I've never heard of it, but because it's autoimmune, I can't guarantee any patient anything, but because it's autoimmune, I think we have a good shot, because where Mayo Clinic and Wake Forest are looking at her as a kidney issue, it's actually an immune issue, right? So there's over 100 autoimmune diseases. They all have fancy names and everything, but the crux of it is that they're all the same in that it's an immune dysfunction. They're just named by what tissue or organ the immune system is attacking. Right. So I told her, I've never seen it before, but I've worked with tons of autoimmune patients. So I feel like I can help you, absent a guarantee, because if we can figure out what's going on immunologically and address that, then teaching your immune system to say, that's Pam, don't shoot at that. That's not Pam, shoot at that. If we can do that or promote that discernment, then we can win where other clinicians maybe haven't helped her. And so that's what I'm looking at with patients, whether it's, Hashimoto's or PANDAS or rheumatoid arthritis or some acronym that I've never heard of.
Are there particular types of tests you like to run first to understand kind of what's going on in the body? It's when you're dealing with an autoimmune issue, at least with my son, when we worked through his, it was linear, but it was not linear. It was, we got to work as quick as we can, particularly because he inevitably, he was diagnosed with autism, but it was really PANDAS PANS. And thankfully, we're, over a decade past that, and he's doing great. And he's a great A student, elite athlete. But,
Awesome.
what kind of process do you like to take people through in terms of how to attack an autoimmune diagnosis like this? Because it's really scary for most people. It sounds permanent. It sounds awful, and but there's so many things that can be done to kind of unravel this.
Absolutely. It is permanent technically from where we sit today scientifically, because to technically cure an autoimmune disease, we need to know how to delete the memory cells in the immune system that are recognizing that tissue as enemy. So technically it is long-term, but you don't have to be symptomatic long-term. You don't have to be progressing over time, right? And so the way to, at least the way that I practice to help a patient reach optimal, is I want to honor them as the individual they are. So Pam with Hashimoto's disease is different than Joan with Hashimoto's disease. We're in a system where conventional medicine looks at Pam and Joan as the same. They both get Synthroid. Neither of their immune systems are addressed, and they're both sent out the door. Okay. But you and I realize that 10 women with or men with Hashimoto's disease lined up outside my door have 10 different puzzles that are influencing that autoimmune disease in them. So the beginning for me, or the process for me, is to start with a history, birth to now. It all potentially matters, going back to mom's health going into conception, dad's health going into conception, because epigenetics influence the health of the baby. Was it vaginal? Was there antibiotics? Did they breastfeed? Blah, blah, blah. Vaccine schedule, all that stuff up to today. And then in addition to that, I request the last 7 years of medical records because I want to understand what's been done, what hasn't been done, what have doctors called normal that to me isn't, what have lab trends been, what treatments have worked and not worked. And going through all that, I can sit down with you and say, Pam, I know you as thoroughly as possible to the minute, and based on your history and records to this point, here are the 5 things waving their hand, saying, look deeper over here, right? Those are my informed guesses at that point based on knowing you up to now. I want to prove or disprove those guesses with these tests. Okay. So what are those tests? Well, those vary based on your workup. So I don't do the same testing on everyone. I do what's relevant for you so that we can be, good stewards of your resources. We don't need to run tests that aren't necessary, right? And so that workup leads to the testing we want to run. We run that and get the results back, and we can say, Pam, remember those 5 things. Well, these 3 are not involved in your case. Hallelujah. These 2 things are real based on A, B, and C right here on paper. And so at that point, we've got the objective clinical targets specific to you that you and I can be accountable to. We can say, this is what we're seeking to change. And so then I can create an individualized and specific plan for you to say, hey, go do this stuff. We're going to retest at these intervals and observe for objective change on your labs. And at the same time, you'll fill out progress questionnaires at testing intervals to say, hey, my fatigue's 0 to 100% better, and my anxiety 0 to 100% better, and my gut and my sleep and my pain and my hair, skin, nails, and my whatever. And so when the labs are changing and you're feeling better, we know we're winning. And the goal is to ultimately say, Pam, high 5, great job, spread your wings. The only magic bullet is discipline. We figured out what works for you now. Stay disciplined.
When people are listening and they want to talk to doctors and understand a little bit more, are there certain classifications of tests that you typically will look at, whether it's nutritional, genetic, the presence of any infection, anything like that?
Yeah, so all those things potentially can drive an autoimmune development. And so again, that history and medical record review helps us understand. In Pam, it looks like it's been foods more for her, or it looks like it maybe is a chronic Epstein-Barr or CMV or something, or maybe she's lived in a water damaged building and it's an environmental mold or actinomycetes or some bacterial endotoxin, right? And so that's why that history and medical record review is so important. Whereas you go in another office, you fill out the paper, they never look at it, they have it in case they were audited or something, but it's like the gold starts there. Like that's the first striking of gold that leads you on the trail to like, I want to follow this vein, and hopefully we've got a line right here. And so to answer your question more specifically for you, because I know you don't want the ambiguity, but
no, I understand. I mean, it does need to be personalized for sure. I'm just trying to
fundamentally fundamentally we want to understand the immune system, right? So the CBC, which is short for complete blood count with differential, is run by every doctor in the country at your yearly labs, and should be run anytime you have labs because it's inexpensive. And it's really that test is gold for understanding the immune system if you know how to interpret it. So that would be if you have no money, I mean, that's a $5 test, depending on how you insurance or cash or whatever, right? But that's a starting point. But then if you look at my book, in the introduction, I talk about the immune system, and this is going to be nerdy for a minute for the listeners, but there's 2 sides to the immune system. There's the innate immune system, which is the first responders, kind of the more primitive side, you could say, or the older side. And then there's the adaptive immune system, which is your B cells and antibodies and T cells and killers and things. And so the way things should work normally is you're exposed to a foreign thing. That's infection, that's allergen, that's toxin, that's something. Innate immune system recognizes the foreign thing and grabs it, goes to the lymph node, is trying to hand it off to the adaptive immune system. Okay. If the adaptive immune system, if the handoff is clean, then when that handoff is made, at the same time, the innate immune system is releasing chemicals called cytokines that are influencing the development of the T cells along a certain path. And so as lay people, COVID was a good example. You'd say, well, we just want to take immune boosting supplements, right? What should I take to boost immunity? But the immune system is much more nuanced than let's raise it or let's lower it. Okay. And so one of the reasons we have to be nuanced with patients is because once that handoff is made and we're turning naive T cells, which you could think of as a baby. Okay. It's immature, it's chubby, it's cute, but it's pretty useless. Okay. It has to mature into one of 7 careers, an adult being, say, a doctor, a lawyer, a carpenter, a teacher, or whatever. Okay. And what career it picks depends on what is being presented and what this innate immune cell is releasing into the environment to influence it a certain way. And so to answer, well, what supplement should I take to boost my immune system? It's like, well, are we trying to go antiviral? Are we trying to go more of a mucosal gut, lung, sinus, bladder thing? Are we trying to actually resolve and calm down inflammation? That answer helps us know what supplement to do or what lifestyle strategy to implement or what test we want to look at to observe, are they already immunologically biased that way? And so in the introduction of the book, I have a graphic for you that shows you that stuff. And so understanding that is really the secret sauce immunologically. And that the nerd term is the immune phenotype. So whatever immune phenotype you have might be different than Jones, and that's why your Hashimoto's would respond differently. So the CBC is a baseline test for that. Then running inflammatory markers like CRP or C-reactive protein, the erythrocyte sedimentation rate or ESR, human transforming growth factor beta 1 or TGF beta 1, uric acid, lactate dehydrogenase, understanding blood sugar and insulin, because that's a fundamental thing. Getting an iron panel, because if you can't deliver oxygen, you're going to be inflamed and fatigued, and brain's not going to work well, no tissue will work well. So those are, and there's many more, but those are baseline things to help understand inflammation and the actual type of inflammation. And knowing that helps us know, how do we push back for this person?
Yeah. And then are there certain things that you really encourage people to do from a food standpoint or from a environmental in your home standpoint? I mean, inflammation is frankly everywhere, and you can never really get rid of all of it. But are there certain things that you believe more than others that you help people try and work through? Or?
So remind me of that question if I get lost here for a second.
Yeah, of course.
But just to finish the first question. So there's some blood stuff, right? But then you could, if we're saying, okay, we think it's more gut in a patient, well, then a stool test helps us understand the gut, right? And up to 80% of the immune system is in the gut. So often we want to understand the gut for that reason. You read these health blogs and it's like, start with that gut. And it's like, you're really only starting with the gut because that's where 80% of the immune system is. Okay. If 80% of the immune system was in your pinky, I'd say it'd be like leaky pinky would be all the blogs, right? So a stool test helps you understand the immune system by understanding the gut. And is the gut hyperpermeable? And are there, food reactions? And are there bad bacteria, virus, worms, yeast, parasites there? Do you have healthy probiotics, which are the allied forces to your immune system? So the stool test can help us understand that autoimmune case differently and further than just the blood. You could look at a urine test and or a saliva test that are looking at cortisol and your cortisol circadian rhythm and the stress response and impacts on your sleep and your sex hormones and your stress levels, because all of that influences the immune system positively or negatively. You could do genetic testing to understand, does this person have a genetic makeup that makes them more prone to being inflamed than Pam, right? So Pam has normal genes. She was dealt the best hand of cards you could have genetically. So that C-reactive protein normal range of 0 to 3 For her, we would expect her to always be within normal range if she's not inflamed. Someone that's got a SNP, I don't know if your audience knows that term, but single nucleotide polymorphism, a SNP, a gene variant in the CRP gene or in the IL-6 gene, they're going to be more prone to having a higher baseline CRP than normal. And if that higher baseline is lab high, okay, say, so normal would be 3 or less medically. We'd want you to, optimal is less than 1, okay? But anything above 3 would be lab high. So say we test, say, I'm going to flip it on you now, but say Pam has the bad genes or the gene variants in CRP. So now we're testing you and you've got an autoimmune disease and you're inflamed. Your CRP is 8, just call it 8 for even numbers. Okay, that's lab high. We haven't tested your genes, so we don't know you have that SNP yet. But we go through care, and at baseline, your CRP was high, your ESR was high, your vitamin D was low, your TGF beta was high. Okay, we go through care, your TGF beta comes down, your ESR comes down, your vitamin D goes up. Your CRP is 6.8, moved from 8 to 6.8. So like, hey, all her inflammatory markers except that one have been squashed. She's doing better. What's going on here? So then we might think, okay, is there a gene variant here? We test it, you've got a positive CRP variant. Now that changes our clinical expectation for you. You might not ever make sub 3, okay? But because you were 8 and it moved to 6.8, we at least know you can do 6.8, right? So then moving forward in the future, if it ever goes lower, say 5 is the best you could be. We've seen a 5 eventually. Well, then we know 5 is the best Pam can be CRP wise. So if you think you're flaring, we could run a CRP and be like, hey, it's 8 again. So we know 5's her best. We know she's flaring, right? So we can, genetic testing is helpful in that we can't change your genes, but it can help us understand what's realistic for your test results so that you don't move forward not knowing that and you're always like thinking you're failing because your CRP won't go down to normal. And it's like, that's not a realistic goal in that case. So those are tests. Other examples of tests we could use. Now, remind me of your question you asked last time again.
So you've got the person in front of you. You've chatted with them on the test. In my experience, it's a long process, kind of talking people through the fact that, you're going to have to be patient as we're working through this. And in our case, it was over a year. I don't know if you've found, obviously there were incremental improvements, but before we were back where we wanted to be, it was a good year or so. Do you find that, you have to kind of talk people through certain things? And then is there maybe particular things around food or in their environment that you really recommend to reduce potential inflammatory things that can happen to the body, which might make it flare more than otherwise? Or
I at least in my practice, we're just fire hosing you. Because a lot of times you've seen 10, 12 doctors, you're getting no better. It's been years and the family's ready like to change too, And so I work in a 3-month block and my goal is to say, if I figured it out, my job is to figure it out. If I did that correctly and then you go do correctly, it shouldn't take a year because the body wants to heal, right? It just needs the right things in the right order and specificity. So that's not to say that we get everyone better in 3 months, but you should be changing even quicker than 3 months. Okay. If we've all done our things right. So when I figure out what's going on with you, we're tailoring that plan to hammer it from every angle. So it's like, hey, nutritionally, eat this, don't eat this, time it like this. Physical activity, do this type of movement, this time of day, this many days a week. At this intensity. Stress reduction strategies do these things. Toxin avoidance do these things. Sleep hygiene do these things. Supplementation, weeks 1 to 3 with food, without food, this many times a day, ramp up like this. Weeks 4 through 6, fold these in. Weeks 7 through whatever, fold these in. So, you can think of it metaphorically as you've got the Pam for dummies on your fridge. And it's like, what week am I in? What am I doing? And because if it, for the patients I see, if it were just diet or just a supplement, I wouldn't see them because Google would have let them there, right? And so our society is very, very, very bought into just tell me what diet to eat and I'll be good, or just tell me what supplement I need and I'll be good. And it's like if that was going to work for you, you wouldn't be here. So I look at it as, again, Pam, as a puzzle, and will your care, some 100% of the care you need will have some percent nutrition tweaking or necessity in it. It will have some percent supplementation. But if that's all we do, you're leaving all the percentage of physical activity, stress, sleep, toxin, EMF exposure, blah, 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 that no one else has addressed. And so you don't get optimal if you're only addressing, 2/10 of the pie, right?
Yeah, a lot of people don't talk about EMF. So like with my kids, I ask them to keep their phones away from their bed. You
Oh,
know,
yeah.
what do you what do you what are you seeing? What do you suggest? This is still fairly new, I think, for a lot of people to understand that it does cause inflammation. Um,
Oh yeah, there's no doubt that it causes inflammation. It's just who's funding the thing that you're reading, because obviously these people who own the towers don't want it to be accepted that it causes health issues, because then they could be potentially liable. But there's declassified information from Russia from the 70s saying millimeter wave technology, which is 5G, is toxic to eyes, kidneys, gonads, brain. Okay. And so, and cancer promoting. And there's more recent studies following that, and especially in kids with not a fully developed blood-brain barrier, holding cell phones up to their head to talk is like, ugh, so like use speakerphone, okay, or have it as far away from you as possible when you're talking, and absolutely don't sleep with it near you. Adults shouldn't either. Like I unplug my Wi-Fi router at night. I leave my phone on off or airplane mode down in the kitchen. Like if you call me at 4 a.m., what am I really going to do for you? Like I'll see you in the morning. So you have to realize that we are electromagnetic beings, and that external non-natural EMF field impacts the fields that we put off, that we live in, that the earth puts off. And so we're basically a walking experiment, because we're the first generation with this, so my bias is to always be conservative and natural, and so the less we can be exposed, the better. And so to your point, I don't know if you know this, I was just turned on to it recently by a patient, but there's a company called Lambs. It's getlambs.com, and they have EMF blocking clothes. And so I've purchased a t-shirt, a hat, and a beanie, and they block 99% of all the G's. And it blocks the sun too. So if you're worried about UV, and it's done by the silver is embedded into the clothes, kind of like spacesuits are for astronauts. And they've got videos on their site where they're doing EEGs, and they put a phone near their head, and then they put the beanie on, put the phone near the head, and the brainwaves are different. Like it's pretty cool. So I don't get any money from them. They don't know me. I've just been a buyer myself, but it's comfortable and nice. It's not inexpensive, but it's for people who are. I don't have electrohypersensitivity syndrome, but that's an actual diagnosis. So for people who are, this might be a way for you to be out in the world.
yeah,
You
that's
know,
awesome. Do you find right now that you're seeing, kids versus adults? Do you find that you're seeing more one than another, or do you kind of start with one and then you work through the whole family eventually, or how does that kind of work with you?
it's I mean, it's more adult just because adults are making the healthcare choices, but there's more and more kids as parents know that we'll work with kids. It's like we'll get inquiries, do you work with kids? And it's like, yeah, absolutely. Don't wait till they're 20 or 30. So it's usually the moms making the healthcare choices. So if they find us and ask them, yeah, we work with them. The men are dumb typically. They don't want to come in until they physically can't work, and then they want to be better yesterday. So the women are more likely to be on it and be making those choices. So my practice, it's more adult than kids, but I think only because the adults hadn't thought about it.
Do you find that you're seeing a certain type of diagnosis more than another lately, or anything that's just?
I don't. I mean, I don't. No, I don't think so. I mean, I guess maybe anxiety, panic, heart rate rhythm stuff, which we could conjecture about recent novel influences to that. So that might be.
Yeah, it's one of the things my kids are older, and so one of them is anxious, and so I keep trying to explain to him that it's possible to influence that more through other things besides medication, but he doesn't seem to want to.
Oh yeah.
Doesn't seem to want to take me
Yeah.
up on that one, but
Actually, I posted a testimonial video last week on a lady that was she had depersonalization, severe social anxiety, so she couldn't leave the house, and she was dependent on Ativan to sleep and just exist. And so we started working together, and we just had her 6-week follow up, and and it didn't even take 6 weeks. She emailed me after 2 weeks, but she's taken the kids on play dates out in the world again. The depersonalization's gone, and she hasn't had Ativan since she started care, and so she's obviously a whole different person. And she had seen multiple conventional doctors and tried all the SSRIs and all that, and nothing helped her. And I had a conversation briefly on social media recently where I said this was framed by conventional medicine as mental illness, and the problem with that, and today everything's mental illness, which is unfortunate because most of it's not. And so she was failed because they're looking at her through the wrong pair of glasses rather than looking at her individually. And so her deal was metabolic, and there were multiple contributions. But once we figure those out and address them again quickly, she can have her life back. And so anxiety, depression, fatigue, migraine, all these are non-specific symptoms, meaning just because I'm anxious doesn't mean it's here. Okay. Anxiety could be you're sleep deprived. Anxiety could be blood sugar issues, thyroid issues, hormone issues, gut issues. You might be anxious because you have a board exam coming up, which is normal anxiety. Maybe that's a signal of your body trying to tell you study more. We can't just hear anxiety and go to Xanax. We should say anxiety, why, what factors matter, and then address those, and then observe, does your anxiety reduce? And you talked about genetics earlier. There are people who are more anxious at baseline due to their constitutional makeup, which genetics contribute to. And so again, should they be on drugs their whole life? No, because drugs aren't going to change their genetic physiologic level of anxiety, right? So if we had Pam that's, if my baseline anxiety is here and Pam's is here, she's more anxious than me. But if that's her physiologic level, we're cool. If Pam's level goes up here, then our goal is to get it back to this. And if we do that, then, hey, this is Pam, right? So then it's first know thyself, and do you have strategies to help, literally rubber band snap yourself out of it if you start going that way. You do a lot better than just being dependent on a medication that by definition is toxic.
I feel like it's still fairly new, and people are still trying to grasp the physical body and the brain, really do work hand in hand. But I feel like we're finally getting there. Is there anything else that I have not asked you about? You wanted to touch on? You have done and continue to do so much.
We could talk for a long time about stuff. So I would throw it back on you. Your audience better than I do. So what is a question, they might have, or what's the most common, say, ailment that you are corresponding with? And then maybe I can give you some targeted stuff.
No, it's autoimmune, autism, anxiety, depression, ADD. It's those.
Okay, so what would be considered neuroautoimmune, right? At least the autism, PANDAS, that sort of thing. So, again, we want to be individualized and specific because those there's going to be a neuro component because PANDAS, for example, is neuroautoimmunity, like you're targeting brain targets. But again, the blood sugar and the sleep and the foods and all of that and the gut, all of that play in. So PANDAS conventional treatment is here's some psychiatric meds for the behavior. Maybe you go to IVIG or plasmapheresis, but they never run a stool test, right? So that kid's gut could be a mess since birth, never addressed. And if that's true, their immune system was compromised since birth, and now they don't handle strep the way its sibling did that wasn't as compromised. And we're like, well, why is Johnny so messed up? And why aren't these drugs helping him? And it's like, well, no one's ever addressed the driver. So, the brain gut brain loop, if we just take a medication to kind of pinch this end of the clothespin, right, of the brain end, but we leave the gut open, this drug might help for 2 weeks, right? And then the physiology is like, and here we go again, because we never pinched off this end. So again, that's why we have to understand the whole puzzle and say, okay, there's a time and place for meds, and if we need them, cool, take them. So that buys us time to win here. But then if we win here, can we phase these out and not need them and maybe use natural strategies to win here and stay that way?
Yeah, that's why we never did IVIG. I mean, I looked into it obviously, but it didn't seem permanent. It didn't seem to really get to the root of the problem. And I'm not saying it's not a valid treatment. It just, I didn't go that route.
There's a time and place.
Yeah.
But I've seen many patients who did that first, and it's expensive and invasive and, not as successful as finding the cause. And I'm biased, obviously, towards finding the cause, but you can have success doing that.
Yeah, I agree. I was very lucky to have found a doctor that was originally from Asia, educated in the States, and said, we have to fix his gut. And at the time, I had no idea what that meant. And, she led me down this deep dive on certain probiotics and prebiotics and removing gluten and sugar and how to get this, ship righted. And it's super interesting what the gut could be doing.
And look at all the people that you've helped because of it.
Oh gosh, yeah, thank you.
Yeah. And so maybe you could point them to that vibrant presentation I did for the ones who like all the science stuff, because
I'll put that in the notes.
There's 3 patients in that presentation that I took through. One was MS, one was PANDAS, one was autism. And so you can see kind of how I worked them up and their trajectories of their cases. But then in there is science of, like, for the autism case, here's why the gut matters. If you're lacking this in the gut, that's not providing anti-inflammatory stimulus for the brain. And so you're now more inflamed, more behavior, et cetera. So maybe that's useful for some people to see. And then in my book, each chapter is a different autoimmune disease with a different case from my office. PANDAS is chapter 4. So I did Crohn's is chapter 3 as an example of a GI autoimmune. PANDAS is chapter 4 for neuro, and then chapter 5 is brain gut, connecting the two, and looking at concussion, traumatic brain injury, and things that way. So that can be found on Amazon, paperback, hardcover, ebook, Audible, any way you can consume it, it's there. And then my YouTube channel has over 1,100 videos.
That's awesome. Well, thank you so much. Really appreciate your time today.
Yeah, thank you for the opportunity.